The largest nursing strike in NHS history is underway, with nurses in England, Wales and Northern Ireland taking part in industrial action. The Royal College of Nursing says staff were left with no choice after ministers refused to reopen pay talks. But the government says calls for a 19% pay rise are unaffordable. So what does it mean for patients? Well, life-preserving treatment is protected, with staff in services like intensive and emergency care expected to work. So if you have an emergency, you should still call 999 as usual. But services including some cancer treatments, mental health care or urgent testing may be partially staffed. And more routine care, such as planned operations, community nursing and health visiting, are all likely to be badly affected. In England, nurses from 51 hospitals, mental health trusts and community services are on strike. That means about a quarter of trusts or services are affected. But there won't be strike action in many parts of the country, including Kent, Lincolnshire, Surrey and Manchester. In Wales, 6 out of 7 of the health boards there are seeing industrial action, while all of Northern Ireland's health trusts are affected by the strike. But in Scotland, no nurses are striking today after 2 unions voted to accept an improved pay offer. Ballots for other union members are underway. We'll be live on the picket lines with our correspondents in Belfast, Cardiff and London in just a few minutes. But first, our health correspondent, Catherine Burns, has this report.
Yay! Lindsay Thompson's been here before. She was on the picket line with other nurses in Northern Ireland 3 years ago and is walking out today too.
I am absolutely gutted that we're in this situation again.
So it's a second time on strike for Lindsay and others from the Royal College of Nursing in Northern Ireland, but a first for England and Wales. Nurses in Scotland are about to vote on a new salary offer. The main reason is pay. Starting salaries for nurses in England are just over £27,000. They can go up to almost £55,000 for the most senior nurses. But the RCN says the average for an established nurse is closer to £32,000. That is similar to average pay across the country.
I do not know a nurse that does want to strike. There's not one of us that wants to be out on those picket lines and withdraw on our labour. We are nurses. We want to be with our patients.
David was due to have a pacemaker fitted today. That's now been postponed.
I have sympathy with their financial situation, but if you're in a profession where lives are at risk, I feel it's wrong to strike.
The RCN is asking for a pay rise of 5% over inflation, which works out at 19%. The government says it's followed the recommendations of an independent NHS pay review body and offered 4.75% to staff in England, Wales and Northern Ireland.
Yeah, they do deserve it, but maybe not as much as what we're asking for.
I'm conflicted because I do have a lot of sympathy with the nurses, and the cost of living is absolutely going up for everybody at the moment. But similarly, frontline medical services are something you need 100% of the time.
They're saving lives, and I think they deserve what they're fighting for. So I have a level of understanding, although I do have a lot of compassion for the patient safety as well.
Extra hours, the unpaid hours, the leaving late, it has made the job a lot harder.
Rachel told the BBC last month that she was backing the strike, but not every hospital got enough votes to do it, including hers.
I feel sort of conflicted about it, but I know that my colleagues are 100% backing those that can go out on strike. We are with you in solidarity.
The Royal College of Nursing says some areas of medicine won't be affected at all by the strike. So chemotherapy and dialysis should continue as normal. So too should intensive care units for adults and children and paediatric emergency departments. Adult A&Es will be staffed as if it's a Christmas day, but if there's a life or death situation, hospital bosses can ask some nurses to come back in off the picket line.
Well, patient safety is the key priority for trusts. If you need urgent medical help, consider an urgent treatment centre or 111 or other routes. If you haven't been contacted about a planned procedure on the day, the message is to go ahead and to turn up for that procedure.
And this is day one. If there's no breakthrough, a second strike is planned for next Tuesday. Catherine Burns, BBC News.
And earlier this morning, we heard from the head of the Royal College of Nursing, who explained why her union was asking for the 19% pay rise.
What I'm asking for is the 20% that has been eroded from our nurses' pay over the last decade to be put back in. So it's pay recovery. It's not asking for additional monies when you break it down. What I've said time and time again, get into a room, let me set my objectives on the table, let the Secretary of State set his, and I'm sure at some stage both of us will come to an agreement. But we can't get there because every room I go into with the Secretary of State, he tells me we can talk about anything but pay. That's going to resolve nothing. What it is going to do is to continue with days like this.
Pat Cullen from the Royal College of Nursing. We also heard earlier from the Health Minister, Maria Caulfield, who herself is a nurse, and she was explaining the government's response to that request for a 19% pay rise.
I've lived through when we had the pay cut and the pay freeze, and they were extremely difficult times. But I also empathise with the British people, because if we are to afford a 19% pay rise, we can only do that either through borrowing, which we saw the effects of government borrowing only just a few weeks ago on the economy, either through taxation, and I don't think that's appropriate when people are struggling with the cost of living this winter, or taking that money from frontline services, which is not something that we want to do. A 19% pay increase is really an unrealistic ask.